Yeah, the protocol is nothing but most of us would have heard regarding this word called protocol whenever a minister arrives or a MP or an MLA arrives. So what does it actually means? It only means that he or she who is going to follow this need not use his or her brain, but just follow what is written in the document in a simple language. So that is all that is this protocol means. And in the medical thing, how the course of this particular experiment is going to go on. So it's a regular recurring work that is going to be there. So the processes, quality control is all these. There are minimum variations so that if one person is doing the same work as the other, when they are asked to do the similar work, both happen to be doing the same work, achieving the same results. That is what the protocol is going to be there, and it is going to reduce the work effect. You can minimize the time, it improves the credibility, and legal defensibility is going to be there. So regarding these things, when Dr. Amruta had presented, she had shown a book which had the title and the date and the validity, all those things which were written. So each of these committees, like you can have this for a reception, theatre, ward, optometry, floor coordinators, any one of these you can have this protocols that can be done. You have to mention the date of issue, when if you are going to do any revision that is going to be there, if there is any change that is gone, the names of people who are in charge and what they are going to do, and how it is to be released. You will be who is going to be the head of this protocol, or who is going to approve this. It is reviewed once a year. It needs to be current. Whatever the NABH changes they have brought in, that needs to be reviewed, and any changes that has to be added on, and it has to be updated. The old ones have to be archived and not to be kept along with it. So you release 3 copies. One will be for historical, like what has been happening since the day you started. Another could be a backup, and then the one where the people actually use it. You are going to file this original and further copies that will always be there with the administration that is going to be there, and any superseded versions that are collected are destroyed. Ensure that only official copies that you have given how to follow a particular order to complete a task is being maintained. It should be concise, step by step, everything is going to be there. I'll just show you a simple example also as we just go along. This is how a reception, this one is going to be there. When the patient approaches the reception, what are all the things the person at the counter is going to see and ask the patient and get these things. So if this is there, whether this person is going to be there who's already been trained, or you're getting a new person, the new person is also just going to follow this blindly. Means they're just going to follow it, and you're going to get the same result. So there is not going to be any lag in the thing which is there, even if the person quits who is already there. So there you have the responsibility, who is responsible for finishing this particular activity or job, what that needs to be done. So all these things would be there. Now another thing is, for informed consent also, you can have a protocol right at your reception, wherein now we need for even examination. Before any procedure is done, you're going to tell them what is to be done and how it is to be, it is going to be done. If there are any doubts that needs to be cleared, you need to ask them. Get permission and proceed. Be mindful of the privacy, and any religious, linguistic, family norms, all these things have to be taken care of. It should be a choice. It should not be forced upon. So now how are you going to learn from it? First you have planned, done certain things which you have done, put the protocols in position, then you see how many mistakes or how many times things have gone wrong, you study it, again you go back to action, and then the plan for the new cycle to start with. So this is going to be a continuous process that is going to happen. It increases the belief that Change brings about improvement in all your staff. So you're going to maintain the documents improves, the changing environment is adapted, and minimizes the change, resistance for change from your staff. So what do we achieve? What changes will drive our progress, and how do we measure our progress? And in the end, what do we modify to see that our latest changes are taken care of? Okay, I'll just, Dr. Rajiv will be just going through his video now with whatever the operation theater needs that have been there. These are the references which I taken which I just presented to you. Thank you.